You're listening to Everyday Emergency, a podcast from Doctors Without Borders.
Hello, I'm Kate Lee from Médecins and Frontières, or Doctors Without Borders, and you're listening to Everyday Emergency. Today, we're looking at the humanitarian crisis in the east of the Democratic Republic of Congo, or DRC, a huge country in Central Africa that's home to around 111 million people. The northeast of the country has endured decades of insecurity since the fallout of the 1994 genocide in the neighbouring country of Rwanda. Driven by ethnic tensions and a fight for resources, the conflict involves more than 100 armed groups, such as the widely known M23, as well as the Congolese government forces and UN peacekeepers. The most recent phase of the conflict has been rapidly evolving and intensified since December 2024. It has displaced hundreds of thousands of people and resulted in many casualties and violent injuries across the provinces of North and South Kivu. Tragically, MSF staff members have also lost their lives. To learn more about what's been happening and the MSF emergency response, I've spoken to Juliette Seguin, MSF's emergency coordinator in Goma, capital of the North Kivu province in the east of the country.
So the situation in DRC is quite complex. It is a country with a great and very important humanitarian needs. It has always been a country facing challenges related also to security, meaning also the presence of armed groups and control of the territory was quite complex. But since a few years, we have seen also the renewal of opposition armed group called M23 that has progressively expanded its control of the territory, especially in the eastern part of the country. What is important to focus on and to have in mind is that since the end of January, this group M23 has taken the control of the main city in the eastern part of the country that is called Goma, that is at the border of Rwanda and just in front of the Kivu Lake. So since this group has taken the control of Goma, they have expanded rapidly also the general control of part of the territory in eastern DRC, meaning that many parts of the North Kivu province are under now the control of this group, but also the South Kivu, part of the South Kivu province. So this is the situation at the moment. So there is a de facto authority controlling part of the country and focusing in the east. What it means for the population then in DRC and this part of the country. First, at the end of January, there were very intense fighting in the city of Goma itself. We have seen a lot of fightings happening and obviously some consequences and many lives that were lost. We have seen then the impact was also mainly on the hospital related to that, so influx of wounded that the hospital had to deal with. It is important also to know that the city of Goma for the past years was welcoming a very large number of displaced population coming from the other part of the province because there were already fightings happening in different places. So they were, according to data reporting, notably by the UN, there were more than 600,000 displaced people in the camps around Goma that were living there since a few years, and following also the fightings and the takeover of Goma by this group, this population was also requested to leave the camps and go back to their place of origin.
So in those situations where people are leaving the camps, how does that change what MSF does for those people? How does it change how we help them?
So what it changed is that for many years, so MSF has several projects, longer-term projects that were happening in the North Kivu province. If we focus on this province, but since the renewal of this, the fightings few years back, also MSF had set up many projects dedicated to this displaced population that was mainly in the surrounding of Goma. To be noted that obviously access to healthcare was a key thing in general, but also there were many challenges related to epidemics and the needs to prevent them, but also to ensure that people in general in Goma, but also the population of the camps had access to treatment for notably cholera. So this was quite an important humanitarian response by MSF, but also by other humanitarian actors related to this displaced population. And since then, the situation then has changed drastically at the end of January, beginning of February, with this population leaving to the different areas of the province. So now the need is also to support this population in their place, where they are going back. For example, there is a city that is a bit at the outskirts of Goma that is called Sake. This big city, this city has been the theater of intense fightings for months and months, and was almost emptied of its population. Now that the situation has changed, generally speaking, we see a big movement of population going back to this area. But this population is going back to a place where there are many needs. They need to have access back to their lands. They need to have access to education, while all these services or all these activities were not existing for a while. But also they need to have access to healthcare. And the health center in Sake, for example, was not functional anymore because of the fighting, the population that left, but also the health worker that left. So what it changed for us, for MSF, it's that we have changed and as soon as possible and quite quickly our focus of operation from the camps to the place of returns of this population. So we are supporting in the areas of return for this population to have access to this healthcare, knowing that this population had lived in dire conditions for years. That also, as said, there were a lot of cholera in the camps. So there is this risk also because the cholera is also traveling with the population. So we need to make sure that there is in the place of returns also access to this type of care, the prevention and etc. Knowing also that in many places there is no access to water yet because maybe the infrastructure was damaged. That is the case for Sake. The running water, I mean, in the tap. So people go to the rivers or things like that to get water. So us as MSF, what we try to do is to ensure that when the population go back, they have access to basic healthcare. They can be treated. They can women that deliver can have access to safe delivery care. People with malaria, that is a very important killer here, have access to their treatment and etc. So we have really changed our focus from the camps to the place of return. This is a big challenge because the people is scattered and is moving along many roads. And so it's not that easy also to identify the places where the population is exactly going and is relocated themselves.
How many people is it that have moved?
So as said, it was an estimated number of more than 600,000 people living in the camps around Goma. This number are very complex to confirm, but generally speaking, it was the data shared. All the camps around Goma have been asked to be the population has been asked to go back to their place of origin. So we estimate that all the camps, this population that was living in the camps has left in a direction or another. Some have stayed probably in Goma, in host community. Some may have go back to their place of origin. Some maybe a bit in between, because maybe their place of origin is still a place that they consider insecure or of active fighting potentially, so they cannot go back there. In a place like Sake, well, we don't have the exact number, but the city of Sake, before the fightings, there was an estimated maybe of more than 50,000 people living there. So we can estimate that basically this population has come back, maybe a bit more, maybe a bit less. But generally speaking, all the population of the camp has moved to a place or another.
Wow, so it's huge numbers of people. You spoke a little bit about cholera, and I wondered if there are any other diseases that MSF is worried about in these populations as they move around.
Yeah, of course. I mean, in terms when it comes to epidemics, also there are risks of measles epidemics that are quite recurrent in the area. There is also mpox cases that can be seen. So we are obviously following that closely. But generally speaking, we are concern about the population having access to healthcare, because a simple disease, let's say, if not treated quickly, could really become grave and impact for a long time the condition of the person, and could even go to bring to death in some cases when it comes to malaria and etc. So really restoring access to healthcare in the place where the population is going back is essential for the population.
So you've talked a fair amount about that healthcare and that need for kind of almost everyday healthcare for people. But I wonder how much of a need there's been for kind of emergency healthcare in these very violent situations.
So needs of emergency healthcare remain important today, but it's true that at the end of January, especially after the city, the fightings, the intense fighting that happened in the city of Goma, there was a very important influx of wounded in various hospitals of Goma. There was so many hospitals were overwhelmed by the quantity of wounded that they received. So MSF has tried to supported many hospitals to deal with this situation in supporting first surgery. Surgery services in different hospitals, but also we have supported blood collection, then to facilitate also the transfusion in this hospital. So we have tried to support in different parts of the management of an influx of wounded, the health structure for them to be able to cope with these massive needs. So from the blood collection to the analysis of the blood you collect, because before giving it to a patient, then you need to analyze it, and then even these parts, when it's a wartime or it's intense fighting time, you still need to preserve the quality of your intervention. So we needed to go through all these steps while making it happen in very fast to ensure that the patient in need, they were receiving the care they deserved. So blood collection, blood analysis, donations to various hospitals, then support also to transport of patient from a structure to another, depending on the level, the different capacity of the hospital in the city of Goma. Then supporting the surgery departments in different hospitals, making sure that there were capacities enough to treat and to care for the various wounded. So that was really there was a really important need around trauma care for many weeks following this influx of wounded.
How many different hospitals and health centres does MSF support around Goma?
So around Goma, we are in various health center or hospital. So if we take really the situation around Goma, we are supporting an hospital called Virunga Hospital, where we have supporting for surgery, for the emergency room, and etc. We have supported the Keshiro Hospital to increase their capacity, their surgery capacity. We are also working, and we were working also previously in different health centers where during this period we are reinforcing them, ensuring that they have the proper capacity. Then we have various points in town where we are supporting either cholera treatment, either access to various type of care, and we are also supporting water trucking, so we make sure the population has access. So quite difficult even to count the number of points or healthcare points that are supported as such by MSF, but we are really supporting, and ensuring that many places in that the population of Goma and its surrounding have access to healthcare, knowing that we are not also the only actor, but that's quite important. I would say that the key places we are in Virunga Hospital, in Keshiro Hospital as well, in a health center that's called CCLK, in Sake Health Center that is really at the outskirts of Goma. We are also supporting Kanyaruchinya Health Center. And on the top of that, the various points. To be noted that these centers that I'm mentioning, they are around Goma, but then MSF in general in North Kivu is supporting even more structures that are a bit further in the province, a bit further from Goma, but several hospitals, Rutshuru Hospital, Mweso Hospital, Masisi Hospital. So it's quite an important support that MSF is providing in the area.
Definitely. How does the scale of the work that MSF is doing in DRC, how does that compare with other countries where MSF works?
Well, it's difficult to compare because the needs are obviously different a bit everywhere. It's quite an important response here, considering the volume of the need. It's also important to note that humanitarian actors to work in this type of context face a lot of constraints and challenges. So the response of MSF has been very large and broad, trying really to support from community level, prevention, but also access again to water or some basic needs, up to the various level of healthcare, meaning at the level of surgery. Comparing it to other country, it depends the crisis, but we have millions of overall in DRC and in the provinces, the North and South Kivu provinces, there were already an immense number of displaced population. Now there is this new situation, increasing the need or making the situation even more dire. So it's quite an important response that MSF has to do here, and it's also important that we remain agile. The needs are evolving quickly. The situation is evolving quickly, is changing, and not always in the same way. Population are on the move still, even though it's been a few weeks that the camps have been evacuated. So where what MSF is trying to do is really to keep to keep ensuring that we are following the needs of the population, that we go where the most acute needs are, and it's quite complex, especially in a country like Congo. But we are trying to increase our response and to develop it as much as it's needed.
I wondered if there are any patients or any situations, some stories that kind of stick with you from MSF's work in DRC.
I believe there are many stories that we can see every day, that our colleagues that are working in the health center and our doctors and our nurses are facing on a daily basis. Maybe there are interesting a story that I just learned about yesterday. It's a young child in a place. Because of all the fightings that happen, you have what is called UXO, so unexploded ordnances. So weapons or other type of ordnances that have not exploded and are obviously putting the population at risk. And so we had this child that unfortunately picked up one of those and that arrived in one of our structure and that was wounded and he's in good care now, and he should be fine, but it's just to show, for me, to illustrate how a situation that's happened for a while can also impact for quite a long time the life of the population. So what happened 6 weeks ago, what happened even 3 months ago or 1 year ago, has a domino effect potentially on the population, and that we have to take it into consideration. It's not because now somehow in some parts of Eastern DRC the situation may seems to have stabilized, that the need do not remain acute, and that the risk that the health risks that are facing the population are not acute. Also, maybe one interesting thing, we are developing, we are supporting actually through mobile teams, health centers that are quite in remote locations. We are supporting them to restart activities. So it's health centers that were not functional for a while, because the healthcare workers were not there, because the fighting prevented the population to go back, or it was complex. And yeah, we were able to quickly support a health center in a remote part of North Kivu with what we call community mobilization. We had a lot of people coming to the consultation, some that couldn't maybe see a nurse or a doctor for months. It's simple stories, but then we were able every day to support the referral of women to deliver safely in other locations, because we were able to facilitate their referral through an ambulance to a health center that had the proper means to help them to deliver. So this is this type of story that I think are important to also keep in mind.
And in those kinds of situations, I mean, what would happen if MSF wasn't there? Is there any kind of healthcare in place that they would be able to access?
The health system is still partially functioning. Some health center in the province have remained functional all the time. Some have not been functional for a few weeks. Some have not been functional for more than a year. So the population, the challenge is the access, notably in terms of distance, but also potentially in terms of the financial aspect of the access. So in the absence, MSF is delivering free healthcare. We are ensuring that referral is done to the structures. So who knows what would have happened if MSF was not there? But what is sure is that MSF is bringing the access to healthcare closer to the population by doing this type of activities. So we are de facto limiting the risk of death, the morbidity, the mortality of the population living in the area, because they now have access to free healthcare closer to their place, the place they are living.
So in a place like DRC, why is what MSF is doing so important?
Because the situation in DRC in general is very complex. The needs are immense. When it comes to access to healthcare, it's quite challenging. Access, generally speaking, is complex. When it comes even just to access through roads, I mean, traveling within even Eastern DRC is quite a challenge already. Healthcare is not always accessible everywhere. People can live in very remote location where it requires several hours to access to health center. The number of displaced people and population that has been displaced several times over the past month or years is very important. The situation has been complex for many years, and it is degrading significantly in the past month, and it's a still very precarious situation. It's still very complex. When you have so many population that were first in the camps, then hundreds of thousands people, then moving again, it brings they come back with barely anything. So their whole lives have to be rebuilt. So it's very important. And again, we are talking about hundreds of thousands of people. Also, the situation is still extremely complex. The front lines have moved further from Goma in the past weeks, but within the province, still you have active fighting. So still the needs are very important. Still you have a population living close to fighting zones. Still you have population not able to go back to their home or their place of origin. So yeah, it's quite a volatile, complex emergency that is happening now, and we should care, because this is the whole population that is in need at the moment in this part of the country.
That was MSF's Emergency Coordinator in Goma, Juliette Seguin. If you'd like to find out more about MSF's work in DRC or the other places we work around the world, or make a donation to support the vital work we do, you can visit msf.org.uk. Thank you for listening to Everyday Emergency.
For more true stories from the front line of medical emergencies, subscribe via your podcast provider or visit msf.org.uk/podcast.